president, and I love that he black. But I'ma ask him like Bush, where the soldiers at? Now move the camera to New Orleans, where the soldiers at?
Okay, it is a beautiful morning to be here with you on KUTV Rise today. This is Biashara Tuesday. Welcome to the show on this very fateful 20th June of 2023. I'm glad that you're able to create time this morning and start your day with us. This is the best way for you to kickstart a very successful week. And we're going to go through a couple of things that will be helpful to you, especially matters that are happening around the economy. What is happening? What is new? What can you expect in terms of profit, in terms of losses, in terms of revenue, taxes, and everything else that the government is trying to implement in its bid to raise revenue, but also you are trying to raise revenue in the government's economy. So how much are you giving to the government, and how much is the government going to give back to you? Small businesses, social media influencers, and top earners are set to be hit first by the new wave of taxes and levies in 2 weeks, actually, if this finance bill of 2023 goes into effect. It just passed the second reading last week when we were here, just anticipating that second reading in the hallowed halls of Parliament, where some members of Parliament absconded their duties, but others voted an overwhelming majority to pass it to a third phase, which will be happening today in Parliament. And I'll be informing you a bit about that. The finance bill is currently within the committee, and it's going to be amended in accordance to some of those revisions, clause by clause, which the committee members will be having a look at. But then today, there will be a showdown in Parliament between President William Ruto's Kenya Kwanza and the opposition chief, Raila Odinga, as they seek to finally put to rest whether the finance bill will be effective or will be put into effect. And it has 3 dates: July 1st, 2023, September 1st, 2023, and also January of 2024. But the Kenya Kwanza government is putting effective dates for most of these taxes to be in 2 weeks' time, that is as July 2023. And this is going to coincide with that hike in the price of fuel in the Republic, as the government eyes to patch up its budget of 3.6 trillion. This is the first budget of the Kenya Kwanza government and the much touted economic model, which is known as the bottom-up economic model. In other parts of the world, where we get money from the rich and try to save those at the bottom tier of the economic model, we call this the Robin Hood effect. But in Kenya, the Kenya Kwanza government is terming it the bottom-up economic model. Middle income earners, top earners, going to be hit hardest by the new wave of levies and taxes. Small businesses with an annual sale of revenue between 1 million and 25 million are now going to be giving a turnover tax of 3% from the previous or the current, which is 1%, put in there, effective for small businesses which are making revenue between 1 million and 25 million, or 1 million to 50 million in terms of gross sales. Social media influencers, such as those operating digital businesses as well, will start paying that 5% withholding tax on their gross revenue, and this is with respect to the digital content creation that they are doing. Also set for July is the doubling of VAT on petroleum from 8% to 16%, in a move that will send pump prices up. That is petrol, diesel, and kerosene, which will be recording a new high. Proposed VAT on this fuel will have a ripple effect on the economy, with the prices of goods set to rise as well from this, as you know, manufacturers are trying to cut costs in terms of production and transportation to the market. So today, a fresh showdown is looming in the National Assembly between President William Ruto and the opposition chiefs Azimio la Umoja coalition on this controversial finance bill of 2023. How is it going to affect you? How do you feel about it? That's also a conversation that's happening here. Kimani Wachira is the outgoing president of the TVET, that is the TVET Student Association, is the outgoing president, and he'll be here to tell us more on what Kenyans can expect, what his breakdown is, and what he has envisioned we can do in terms of trying to adjust and adapt to the changing times in the cost of living. Much more that is happening also in the papers we'll be discussing in that newspaper review section, so make sure that you're tuned into that with the latest and the most current headlines and hard-hitting stories in the papers this morning. We're going to fasten all of that up because we're looking forward to more of conversations that are happening on Biashara Tuesday. We have guests invited here for you. This is a month that most countries recognize as the month to mark men's mental health awareness. Men's mental health awareness. I also did mention this last week on Tuesday. This month we're trying to appreciate men and also see if they're well mentally. I went out to the streets, spoke to a couple of young men, asked them what their thoughts are about men's mental health, what their mental health status is, and if the cost of living is affecting the mental health of specifically men, and if it does, how so? So that's a conversation, or that's a very interesting discussion that I had, and also views from very many young people out there who are feeling the pinch of the economy. You'll be getting to see what they had to say, and also hear your feedback and reactions to some of those questions that I did ask them. I'll also be sitting down here with a reverend who is also a mediator, and that is Reverend Eddie Waiguru. Reverend Eddie Waiguru is a professional mediator. He'll be continuing on that conversation on mental health among men. The highest percentage of people running businesses in the Republic, the highest percentage of people who are earning an income for families is men. So the mental health is important for us as Biashara Tuesday. We're trying to make business work. We're trying to make work profitable. How are men surviving in this work environments and also in business, and how can we ensure that their mental health is always in check and we are taking care of the men in our society? Later on, I'll also be sitting down with Isaac Ogutu. He's a fourth-year student at Kenyatta University taking medical laboratory sciences, and he'll be informing us of his goal to ensure that we are getting fit. Men are getting fit, but also everyone else is getting fit, and we are avoiding those non-communicable diseases. He has an initiative himself. He'll be telling us more about it as he joins us on set. So Isaac Ogutu will be here. Any questions that you have for him, please make sure you send them through to us. If you're joining us from the diaspora on YouTube or elsewhere, KUTV Kenya live, that's where we'll be streaming the show at from 7 a.m. all the way to 10 in the morning. No beats missed, so join us there on the live discussion. Leave a comment, tell us who we should give a shout out to, and we'll be loving to interact with you all the way to the end of the show. There's a story that has been hitting the nation since yesterday. Actually, for the past couple of weeks, NHIF has been experiencing problems here and there. Health Cabinet Secretary, I'm seeing here on the front of the Daily Nation, Health CS Susan Nakumicha, has suspended some NHIF branch managers, and this is a day after the nation exposed how rogue hospitals were stealing millions of shillings through some medical camps which are targeting elderly patients. As that is happening, that conversation with Isaac Ogutu is going to be really important for you. You can see the dire situation in hospitals, so you're trying to ensure that you're not going to any of these hospitals and getting a situation where you cannot afford your Medicare. So how do we prevent that situation where you can't afford your Medicare, or some of these scandals might put you in quite a tricky situation? So be excited for that and much more of those conversations. Tag me on social media, tag the station at KUTV Kenya. My name is Richard OKENYE. Welcome to the show. Current transport. What is happening this morning? It's not even cold yet, but current transport and traffic conditions in the city, I'm giving them to you courtesy of MA3 route. But speaking of MA3s, before we get into the roads, there's an ongoing mandatory test for public service vehicles in Kenya that is being conducted by NTSA. So these drivers of matatus are being they're being told to do revisions or to retest themselves, and many of them are failing this license renewal test. They are not fit, a majority of them, according to NTSA. This is because only 18% of those tested between June 9th and Friday last week passed the written and Applied Theory Test, which is being conducted by NTSA in Likoni Road, that is right here in Nairobi. So far, they've tested 302 PSV drivers and only 54 have passed. 302 and only 54 have passed. If you're heading out to Matatu this morning, tell me how confident you feel your Matatu driver is in terms of competency if they were to sit this test, or if they already have. Do you think they would pass, yeah? And how confident do you feel in these PSVs? They should also extend this to personal drivers, don't you think so? There are many madmen on our roads, but let's see what is happening so far as of this morning. Foresight Finana saying Newton's third law, for every force there's an equal and opposite reaction, and this is in saying 99% of drivers in Kenya have commercial license endorsed, including CEOs, MPs, etc., but do not do due diligence. So trying to relate that with the Newton's law of motion, but I'll be getting that in a bit. Good morning. Nani ako na ile video? That is Oscar Anandu. Seems I'm still trying to catch up in what is happening on those roads. Jogoo Road is so clear this morning. I Muthoni is informing us. Yesterday there was a carjacking happening at Total Barnabas, and we'd like to get more information from you, Sang Kautet, on Thika Road. It's looking promising this morning for the first time. I don't think it's for the first time, actually. We've seen this a couple of times before, but Thika Road looking good for you if you're heading out to town. Amount of soil has been left on the road at Bellevue, U-turn back to town, and this is Mombasa Road. So the contractor has left that over 3 weeks now. Surely such unprofessionalism, it's causing a lot of inconvenience over in Mombasa Road. A car has also been parked at Northlands along Thika Road. 3 men are out and 2 are kneeling down. So that is Tatu Muchigi. We'd love to know what exactly is happening there. Here, there's more information that is happening from Parklands. If you're in the underpass heading to town or to Westlands, Kameshikana Sana, the only option you have is that expressway on the Museum Hill, so you can try that. Motorcycle riders are causing a huge number of accidents on our roads daily, but I can't see anything being done about them. Why the selectiveness? This is Mutunga. I hope Mutunga is not a PSV driver complaining because of the retesting they're doing, but also Boda drivers or Boda riders, they should be taken for that renewal of licenses. And we see how many of them are actually competent and have done the due process in acquiring their driving license, or even they have the necessary documentation. Why the retesting fee? Also pay a PSV badge of 1050. Why double payment for the same service? So yeah, truly, there are more PSV drivers complaining this morning here because of that retesting. Brace yourselves as well. New taxes, VAT on fuel as of July 1st, if by the third reading today, or when the president signs this controversial finance bill into law, the pain at the pump is going to hit even harder. So brace yourselves on the roads, PSV drivers and other road users. We'll be getting you more information on those developments. Welcome once more to Biashara Tuesday. Interact with us on the hashtag Biashara Tuesday. I'm going to take a look at what's happening in the world of news, internationally, locally, matters of economics, politics, and everything in between. And then we get back to Biashara Tuesday and focus much more on business. Don't go far. All right. We are going to have a few conversations happening here this morning. Kimani Wachira, the president of the TVET Student Association, has been on the show before to help us break down the hard-hitting stories of the dailies this morning. The Business Daily and the Daily Nation I have here with me. If you have the Standard, the People Daily, and the Star, which are daily papers, you can tell us the headlines there and the reactions, of course, to what the pieces of news are. I told you there is a scandal brewing in NHIF. Last month, the remittances were not done because the national government was saying it's broke. The coffers are empty, not enough to be put into these hospitals. And therefore, many patients, of course, suffering. There is always a looming strike of doctors and nurses in the Republic because of one reason or the other. Their payments are not done. Medical interns have not been paid for 6 months now. So if you're walking into a hospital currently, you're not so sure if you're going to come out with, in the best of your expectations. So you're trying to make sure you don't get to that stage where you need to look for a doctor here and there because of one reason or the other. And some of those preventable things are non-communicable diseases like hypertension and diabetes. This morning, I have Isaac Ogutu, a fourth-year medical student of Kenyatta University School of Health Sciences. He's pursuing medical laboratory science, the BSc Medical Laboratory Science. He's the founder of Afya Fitness Healthcare Initiative and is here this morning to help us know exactly what are the preventive measures you can take, some of the personal lifestyle adjustments that you can make to ensure hypertension, diabetes, and other NDCs, non-communicable diseases are not getting to you. So be looking forward to that conversation. As we talk about health, we'll be transitioning into mental health. Men's Mental Health Awareness Month this year, marked by many countries around the world. Probably not popular in Kenya, but here on Biashara Tuesday, we're trying to sensitize ourselves in ensuring mental health amongst men is a priority and is something that is a key focus for everyone who's around men and also for men themselves. I did ask a few men, young men actually, how they feel, what their mental health status is, and how the cost of living is affecting men's mental health. We'll be seeing their reactions later on in that presentation that we've prepared for you. But Reverend Eddie Waiguru is a professional mediator. He'll be putting that conversation into perspective, men's mental health, and how better can we get with that very particular conversation. Biashara Tuesday is still on air. Let me welcome Isaac Ogutu. I'll be back after this short break.
To the Church O'Clock Show. I'm your host, Esther Becky.
And my name is DJ Terrell.
We start you off with a word of prayer and get you started with a live transformational worship experience. And have our minds renewed by the word of God on the word segment.
And not forgetting new music za hii wiki, yani ndakuwa bado nawapatia pale wasanii wamekuwa kiwakali. So make sure manzo tune in because zitakuwa zina flow pia pale mixes kwa wingi, yani zitakuwa zina come through, and pia performance yani from our gospel artist hapa on Gospel Art
from 7 to
10 a.m. only on KUTV.
being black is a risk factor as compared to the whites and Caucasians. Blacks have been found to get fibroids more frequently.
Uterine fibroids is manageable and preventable, and we should seek medical advice as soon as possible.
Access to knowledge, solution to unanswered questions.
Guidelines to pursuing your rights and repossessing your property, intellectual or material.
This and more, only on Law Matters.
A loving husband and father.
Nothing is too good for my daughter.
An ambitious businessman with a dark secret. A girl with a whole life in front of her, plunging into a marriage that she did not choose with the wrong man.
I'm not ready to marry Zema.
But who is the right one? I love Nambi. A rock star living the dream.
But the babes keep chasing me again, sir.
It ain't easy being famous, especially with so many glamorous women around. A woman hell-bent on revenge.
He will pay.
Seductive, dangerous. She is a predator. Everybody needs it. Everybody wants it. They will do anything to get it. Love and wealth.
Are you an aspiring media practitioner, a graduate, or you just want to advance your skills in television production? Then welcome to Kenyatta University, where education meets innovation. KUTV, the premier university television station in Kenya, is now offering short courses in TV studio, field technical operations, and video editing. Through these courses, you will acquire hands-on skills on camera operations, media production, lighting techniques, audiovisual editing, and sound and visual control, and how to operate key equipment in modern TV control room. Enroll today at KUTV and discover your full potential in cutting-edge TV broadcasting. Graduates of these courses will receive professional certificates. For more information, visit our offices at KUTV Studios or call us on 020-870-4252 or 020-870-4255 or SMS us on 0739-110-544. KUTV, a new experience.
Welcome back to Biashara Tuesday. Isaac Ogutu is already here with me on the show, and we're kickstarting with this conversation on managing lifestyle diseases, non-communicable diseases. Actually, that's the general term, NCDs. He's a fourth-year student at Kenyatta University School of Health Sciences. He's undertaking medical laboratory science, and he has his own initiative that is conducting public awareness and also much more that he'll be informing us here. It's called Afya Fitness 20, if I'm not wrong, but I'll allow him to introduce himself and his initiative as well before we get into this whole conversation. Welcome to the show.
Okay, thank you so much.
Right.
My name is Isaac Ogutu. I'm a fourth-year medical laboratory student from the School of Health Sciences. Just like you've been told by my host here, I have an initiative I founded in the year 2020 during the COVID-19 season era. So I thought about it, how people were being in quarantine. There's a bit of lockdowns. People are really suffering indoors. There's a lot of mental health issues and so on. And again, because there was lockdown and people are not getting out unless you are designated to do so, there were a lot of physical inactivity. So these physical inactivities all over time, they led to a lot of health issues. So me coming with Afya Fitness 20, people are desperate, like they don't know what will happen with Corona the next moment or the next minute. So I was there to give them health education. You should be doing this, you should wash your hands, you should take lemon water, because COVID-19 is a virus, and a virus are very susceptible to I can say detergents or solutions that have low pH and so on, like the lemon has an acid. So while I was interacting with people on those health issues, I think the idea came about Afya Fitness 20. Now, Afya is a Swahili word to mean health, and the fitness part of it is to mean okay,
right.
Physically fit, mentally fit, health, spiritually fit, and so on. So 20 part of it is the year that it was formed. Now, healthcare, there are components of healthcare that includes preventive, curative, and diagnosis. So whatever I'm doing is preventive. I want people to prevent. Prevention is better than cure. They say so.
Right.
So, and then initiative. In this case, we are working to ensure that people get sensitized, people get an awareness, and people get that bit of information. Perhaps they cannot receive on other end, or if they receive on other end, they have to pay.
Right.
Yeah, but I'm making things easier with passion to educate people.
Right. Two things that I've noted from that very powerful introduction you've done there is there are two things that patients who get these non-communicable diseases or any other have to go through. It is the cost and suffering, right?
Yes.
So how does early diagnosis and this kind of preventive education on personal lifestyle adjustment help in reducing the cost and suffering that people will eventually have to go through if they get this kind of diseases?
Thank you for the question. Okay, I'll repeat my saying as they do say, prevention is better than cure.
Right.
Now, early diagnosis in any disease is very, very much important. You realize that when I'm talking about non-communicable diseases, these are the diseases that don't attack people acutely. When I say acutely, it means with sudden onset. Talk of diabetes, talk of cardiovascular diseases like hypertension, that is elevated blood pressure, and also talk about cancers. Prostate cancer in men, cervical and breast cancer in women, and talk about chronic respiratory diseases or conditions like asthma. These are the things that they will not attack you suddenly. They will progress bit by bit. And what people don't realize is that for you now to exhibit those signs and symptoms, it will have actually taken you time. And there's about 26% of Kenyans, they don't know about their high blood pressure status. The other day, I think it was last week, I was giving a lecture on high blood pressure. I think if you go through my Facebook page, you'll see those videos. And I highlighted that around 26% of Kenyans, they do not know their high blood pressure status. Now, someone will wait until signs and symptoms start showing up, is when now he goes or she goes to clinic or hospital to get tested. Now, when it reaches at that point, just know that that thing has developed over time in your body, and perhaps now has reached to an extent where it has perhaps suppressed your immune system. So early diagnosis is coming in to help people prevent those costs, because you look at these non-communicable diseases, even though there are no treatment, because there's no treatment for cancer, it's just management. There's no treatment, the right treatment for diabetes. We can say that absolute treatment like malaria, how it is done. No, it is just management. So the earlier you can diagnose or you can get diagnosed of these diseases, the better they can be managed.
Before I get scared of that suffering in the course, after eventually maybe having gone to hospital and realizing, I should have recognized this early. How should I, what should I do early to ensure that there's that early diagnosis and prevention way before I get, told that now you have diabetes, you have hypertension?
Now, you will realize that there's something funny about these NCDs, the non-communicable diseases. And that's why I came up with a program this year that is called AFIA NCD. NCD is non-communicable diseases. So it is AFIA NCD series. It's a series of videos and pictures and information to tell people how you can actually prevent this before it happens. Now, you realize that these 4 principal non-communicable diseases, they can be prevented, one, or they can be caused. Actually, I should speak first of caused, and now from the caused we can see how we can prevent. So the causes of these things, there are very 4. We have 4 non-communicable diseases, and we also have 4 causes.
All right.
Cause number 1 is alcoholism. Chronic alcoholism, people taking alcohol. Yeah. And cause number 2, it is smoking. The smoking of cigarettes, the smoking of bang, and so on. Cause number 3 is inactivity, physical inactivity. Like, people are not exercising, they are just there, they are eating. Is like they are inputting and not outputting. And then cause number 5 is pathetic dieting. We are in era of where people, they don't have time to cook, for example, or they don't have that time to cook natural foods like it was done traditionally. We have these fast moving foods, people just get and eat. So we are having an issue with pathetic dieting, physical inactivity, smoking, and alcoholism.
Funny you say that, because there are people who drink, smoke, are inactive, and have a pathetic diet, and that's just one person. So those are very prime candidates for these NCDs.
True.
So from the causes now, how do you prevent this from happening?
So how we prevent these non-communicable diseases from happening, I will be tackling each cause.
Okay.
Now, for example, I'll start by smoking. If you do some research, you realize that one roll of a cigarette has around 4,000 chemicals. And for all those 4,000 chemicals, the chemicals that people know are only 3. That is nicotine, tar, and carbon 2 oxide. Now, nicotine is the chemical part that causes an addiction. And tar is the one that causes the blackening of the lungs.
Right.
And then the carbon monoxide is a very dangerous gas, is a silent killer. Yeah, you see these people who succumb maybe in rooms with poor ventilation while they have lit their jiko or their stove and so on. They die because our bodies, how we are naturally made, is that our red blood cells have high affinity to carbon 2 oxide, more than even oxygen. So they tend up to take in more carbon 2 oxide than they take oxygen.
Right.
So when considering that fact of smoking, you will realize that once your lungs are blackened, you are very much susceptible to any disease that can affect the lungs. And then by chronic smoking, by each puff you are inhaling carbon monoxide, you are killing your cells. And when you are killing your cells, actually in a long run, you'll now be susceptible to any infection that can attack you hematologically. And then, so you find that when we want to deal with issues that maybe affect the lungs, the lower respiratory and the upper respiratory systems. And these lungs are connected. When you look at the cardiovascular system, you realize the lungs is part of it. Now, when you quit smoking, I'm not saying that you quit, you stop right now, but there are strategies that you can use to quit. Yeah, you can use to quit. So when you use those techniques that you can use to quit smoking, actually you will be preventing yourself. Look at alcoholism. Our Deputy President, Honorable Rigathi Gachagua, has been leading an iron fight or an iron fist in Mount Kenya region, fighting alcoholism and even the whole Kenya. I looked at Honorable Sankok of Governor for Narok doing the same thing, and Maua in Maragua constituency was doing the same thing, fighting alcoholism. I thank these people because they're doing the right
You're giving
thing.
a thumbs up. You're saying Deputy President Mambo
Brigade is doing good. Wamaua for Maragua is doing good. Sankok for Narok is doing good. Because as far as medical approach is concerned, you realize that chronic alcoholism, first thing, is affecting the community, especially men. You realize that men become less productive. There's crime rates in relation to that, and there's family negligence, like there's negligence of duties, you see. So those are the things that happen. And when you look at the medical perspective, is that when you take alcohol over time, you are susceptible to developing diabetes, which is also a non-communicable disease.
Oh, I didn't know that.
You are also susceptible to getting peptic ulcer disease. Because unajua mtu anakunywa makali and then that thing burns you right from your esophagus down to your stomach and then to your liver. You know, some people take alcohol and they think that it is your liver that goes down. No.
Nasema leo tunaumiza liver.
No. You know, one thing that people should know, that for your liver to get damaged, that is liver cirrhosis, it takes time.
Right.
The first two organs that first of all get injured before they even deliver, first of all is your gullet or your esophagus.
My gullet is this one. That's
yes, your food pipe.
Okay, all right.
Yeah, and then the next thing is your stomach, because you realize that when you are taking those, they are very corrosive. Some of these alcohols are very bitter, they are very corrosive. So they start by corroding the mucosa, that is the lining of your esophagus and then the lining of your stomach. And some people, they take alcohol when they have not eaten anything. Yeah, they take alcohol on an empty stomach. Last week I was there in the morgue for a post-mortem, that is autopsy. And there was a case where someone succumbed because of taking alcohol.
All right.
And you know, right now people are taking what we call binge drinking. Binge drinking is taking more than 3 bottles because, you know, you want to please your friends, so you want to show how man you are, so you want to take a jug of keg, you know, 5 liters of keg.
Yes. Chafua meza.
So it will lead to, it can lead to what we call hemorrhagic gastroenteritis or something. You know, your stomach bleeds from inside. And when your stomach bleeds or it has blood.
That sounds scary.
Yeah. It's actually, you can die.
So that's alcohol.
Yeah, that's alcohol.
Right. We have 2 more.
We have 2 more. I'll talk about pathetic dieting. With the era of people having fast food.
And this is going to be very, it's going to touch a few, you know, here and there. Fast food is quite a thing now.
Yeah, the right people eating to smoky, not smoky is not bad, but to chips,
chicken fry,
chicken fry and so on. Yeah. You know, most of these things are cooked.
So that's what you're calling the pathetic dieting.
Pathetic dieting.
Right.
You know, first of all, you're supposed to take balanced diet. But people are basing so much on calories. And if they're taking maybe foods, they're taking foods with empty calories. When I say empty calories, means that a food that has it has calories but does not have any nutritive value.
Tell me, I've been seeing this online. Is omena and matumbo one of those? Or are those food that have actually...
Matumbo is nutritious, omena is nutritious.
All right.
Talk of beer, you know? Beer is an empty calorie.
Okay.
Yeah. So I'm talking about pathetic dieting. Now, one thing that you should know is that in computer science, they say garbage in, garbage out, GIGO. What you take in is actually what will come out. Now, these foods that are, they have a lot of calories, kitu ya kwanza, you need to understand that we have cholesterol. Cholesterol is not bad at all, but we have forms that cholesterol is transported in our body, and that includes high density lipoprotein, low density lipoprotein, and very low density lipoprotein. Of all those 3, high density lipoprotein is very good because apart from being transported in your blood, it goes back to the liver for metabolysis. But now you look at the low density lipoprotein and very low density lipoprotein, they stack in the arteries of your heart or your in cardiovascular system. Now when they stack, they make the lumen of your arteries very narrow. And then what happens when your veins, it leads to something we call it atherosclerosis. When atherosclerosis is formed, then it means that your heart has to put in a lot of efforts to pump
that blood can get to every single part of your body.
And now it leads to high blood pressure, what we call hypertension.
Before you move on, there's a question there when I asked about omena and matumbo. Did you say beer or beans as low calories?
I said beer.
Or beer?
Yeah.
Okay.
The beer that people are taking, and then after 5 months they have pot belly, you know. That's just fat.
Okay.
Fat that is for men, fat is deposited in their bellies, especially. Like for ladies, it will be deposited in their butt, their hips, their thighs, their breast, and so on. But in men, especially, it is the belly.
Right.
It is empty. It does not have any nutrition, no vitamin, no something, no protein in it. It is just calories, and they are empty. Yeah, and then
beware of that.
And then the last thing is physical inactivity.
Right.
So physical inactivity, I say it is also a contribution to what we call obesity. Now people are eating, they are inputting, but they are not outputting. Now what becomes?
What do you mean by that?
Is like you are taking in food, apart from you going to toilet and maybe going to urinate, or you are not doing something else to help your body cells actually is then the digestion and so on, and any metabolic process. So what exactly happens is that, for example, you eat a lot of proteins or a lot of fats, and you are not exercising. I've been exercising all over my time because I want my health to be fit. That's why the initiative is here. Now, when people exercise, they burn the excess fat. When people exercise, they actually stimulate their heart, you know, because one thing you realize that when you are in a vigorous exercise, your oxygen consumption raises up. So your body for it to accommodate that raising up of the oxygen consumption, then what it means that it has to make your heart pump more blood. Now when it pumps more blood, it clears the cardiovascular system, because you realize that hizo fats ambazo pia zimekuwa zimekwama huko, they will now is washed out, and then you are fit.
All right.
And we realize that these people who eat and then they sit, especially women, sorry to say that, but especially people who they just eat and they don't exercise, are actually susceptible to very many diseases.
Right. We have a question already here from Nefat, and he's asking about that physical inactivity. And nauliza hivi, I am quite a slender guy. Bro, talk to me directly. Don't go through the corners. These are those people who say, I have a friend. I'm asking for a friend. But yeah, Nefat is saying that he's quite a slender guy. Anapenda kukula KFC, na yeye haoni kama atanona. Does he need to be active?
Kuna ile kunona tunayosema iko in genetics.
Okay.
For example, if you're born slender, or if your parents are slender, chances of you getting, I can say, fat may be very minimal. But that...
so the question is whether they are going to be affected by pathetic diet if they continuously eat fried chicken and chips, and they don't think they're being affected. Does it also affect them?
Yes, I'll tell you. Amesema naitwa nani? Nefat. So Nefat, what I want to tell you is that you don't have to be fat for this thing to affect you. Because when you are eating these foods, as long as there's bad cholesterol, the bad cholesterol that I've quoted is low density lipoprotein and very low density lipoprotein. As long as there's bad cholesterol circulating within your system, you are very much susceptible. And I'll give you another example. We know there's vitamin C and vitamin E. They are antioxidants. Antioxidants, these are the, I can say, chemical components in food that prevent us from getting some these cancers, these cancers. So if NEFAT continues to eat those things and maybe is not eating balanced diet, no vitamins, you are just eating KFC, those are proteins and carbohydrates. You are not taking a lot of vitamins. Even if you are slender, you can actually develop cancer issues because you're not taking antioxidants. So when we talk about slenderness and being lean, it doesn't mean that it is actually fat alone. No.
Okay.
It can be other components as far as nutrition is concerned.
All right. So maybe now we are speaking to someone who's already gone to that. It's already too late for them to do lifestyle adjustment. I don't know, you can correct me if it's ever too late to do any lifestyle adjustment, but this is someone who's now been diagnosed with one of these NCDs, whether it's hypertension or diabetes. What should they do to manage it now? How can they adjust? Should they make other lifestyle adjustments? And I'm guessing this also involves treatment.
For these NCDs, it is never too late until it is late, or until the doctors now can say it is over, or until you breathe your last. But these NCDs, the good thing with them, they are managed. They can be managed, even if they cannot be completely treated, but they can be managed. And I think. So you're asking like if someone is already diagnosed, already has gone to that. First of all, you need to accept that you have it. You know why people or patients are succumbing is that they don't.
Mimi siwezi patwa na blood pressure mimi.
Yeah. So when he or she says that mimi siwezi pata high blood pressure, and yet he or she has it, and then ignores whatever precautions are put into to shield more prevalence of it, he or she will succumb. So first of all, accept that you have it. And then the next thing is that I can say the current reading, because we might all be having diabetes, but maybe the stage of your diabetes not like mine. We can all be having hypertension, maybe yours is not like mine. So know where currently you are, your current reading, your average reading. And that's why I tell people that it's better to know your reading go for checkup. Yeah, go for checkup, take your blood pressure, take your diabetes. Just be sure that my average readings for this period or for this month or for this year are this way. Okay. Now, when you have known that you have diabetes, you have hypertension, what now you should do? I always say that people should have lifestyle adjustment. You know, you've been consuming, for example, and I'll say diabetes and hypertension, they are correlated. And you see that I can say pathetic diet, like taking a lot of sugar, taking a lot of salt, a lot of fat. Those are foods that contribute to elevation of those diseases. So when you can adjust yourself to limiting or taking low sugar, I can see some people, they don't take synthetic. I can say these
processed
sugars. That's the correct term.
Yes, I'm here for you.
So that processed sugar, you know, processed sugar, it is made in factories or in industries, and there's a lot of chemical processes that goes on, you know, because these are just a hydrocarbon. And then so those people, I'll tell them that you do embrace natural sugars. Yeah, so these synthetic sugars, you're supposed to lower them. Even if you're supposed to use salt, lower it. You see, even if you're supposed to use fat, lower it. And some people don't use salt at all, they don't use sugar at all, and that is very fine, because if you eat your bread, if it has some sweetness in it, that is already a natural sugar, I can say so.
I was going to ask actually, what are natural sugar? Should I be eating mapera? And what are some of those maybe you can recommend? Where can I get natural sugars? Yeah.
So natural sugars, these mostly are found in fruits and vegetables. You know why I say fruits and vegetables is because apart from giving you the natural sugars, they will give you other components to which, when you will have taken the processed sugar, you will not have gotten them.
That's true.
So for example, if you take a mango. And I'm not saying you take 2 mangoes and so on when you are diabetic. A slice is enough. Yeah, a slice is enough. Like for ladies, they do say that a slice of pineapple gives the gynecologist away, or keeps the gynecologist away.
All right.
Yeah,
A pineapple a day keeps the gynecologist away. Okay.
So when you are diabetic and you take a slice of maembe, mango, is enough.
Okay.
Is enough.
All right.
Yeah. So, and one thing, if you have those diseases, what you should embrace is physical exercise. During Saturday and Sunday, I see men around here, men and women around here, Thika Road, running from Kahawa maybe to Ruiru or in between. I do appreciate those men, and I do say that is a good thing what they are doing. So when you embrace physical exercises, you are keeping your body at pace, and actually you are helping yourself. You see, that's what people should be doing.
All right, now into the future, you're a student of medical laboratory sciences, and that's a field that is focused in treatment, diagnosis, and management of these kinds of diseases. First of all, tell us maybe how your studies are applying in this very field, and what are some of the future advancements maybe you see towards treatment and management that people can be looking forward to. When we speak about treatment of, let's say, diabetes, you realize the process is quite painful for the few patients that I've interacted with, what with daily injections, and every time checkup, checking up with the doctor and hospital visits and such. And maybe sometimes, a disease comes out of somewhere and puts you on bed rest for 2 weeks or so, and, recovery period takes some time. Are there ways that this will get easier and better in the future that you have seen so far?
So I would like, first of all, to give a coordination between this FANCD and to the course that I'm taking. First of all, BSc Medical Laboratory in Kenyatta University, we realized that you have to go for annual attachment. That is for your 3rd semester. So for my annual attachment, I've been in level 3, level 4, and level 5. I'll just give an example. Amane Cottage Hospital is in Busia County, Nambale Sub-County, and then Busia County Referral. And I've been interacting with patients because you see, a laboratory officer has to take the readings of the patient because there's a test that deal with diabetes. For example, random blood sugar taken any time in a day, that is called RBS. So whenever a patient sees RBS, that is sugar is going to be tested. And there's also fasting blood sugar, that is FBS. This is taken when you have at least not eaten for around 8 hours. Now, you will realize that when I'm taking the readings of these persons, not all of them have the normal range. Some of them are quite elevated, and some of them, they are, I can say, hyper, or maybe I can say the readings are too high to an extent that even a glucometer cannot actually equate the actual reading. It will just read above 33.3 millimoles per liter. That's a very high reading. Now, you realize even for blood pressure, level 3 and level 2, they do use those books. For example, huyo patient atapitia kwanza kwa clinical officer, kwanza kwa desk reception, to the clinical officer, now to the lab. So when you look at those readings and you realize this blood pressure is too high, and again you take diabetes is too high, or maybe it is within the normal range, therefore it starts now to open your mind what this person can be going through.
All right.
Now, you realize that, again, the intervention that I think I've put through when I was back then in Busia County, I've been having a program that is Afya Mashinani, Health Outreaches Program. It's a program that I started this year, early this year, that is January. And I've been, my home, especially on weekend, it has been always busy. People have, when people know that doctor is around,
they have to come with.
They will prefer to come
and talk
to your
you.
home, and when I'm not around, they will make stories with my mother until I come. Now, when I come, what I like to doing is I give you first health education. I'll tell you the trends, how have you been feeling. Of course, you have to come along with your medical book so that I can look at your medical history.
Right.
What have you been taking in form of drugs, whatever recommendation you have been given. And I'll give you a health education, and I'll tell you, yeah, you know, you have to reduce ABCD, you have to reduce this, and you have to also to increase ABCD. I think those interventions, when they're now put maybe in a larger population, it will be something that will help people. You know, for me to test you blood pressure and blood sugar, in the courtesy of the program, I was doing it for free. But now you see, a patient who lacks, for example, cash, yeah, to go to hospital to do that checkups, you know, will feel like sina pesa and that's all. But me, I was helping my people at least to reduce this prevalence of these diseases in my home area. So if that thing is amplified, maybe to the whole Kenya or to the whole county, I think we'll be so much dealing with this afia, we're dealing with non-communicable diseases at a wide
Right.
range.
You're saying that the biggest win or the biggest way in which you can tackle this is preventive measures.
Preventive
making sure that
measures.
you're being checked early and doing lifestyle adjustments as early as possible. And also that's what you are doing in terms of sensitization through Afya Fitness 20, your healthcare initiative. We did tease it a bit earlier. Maybe in a summary of a paragraph or two, you can tell us what kind of activities are happening at Afya Fitness 20 healthcare initiative, and you know, what is it that maybe someone out there can look forward to if they reach out to you through this program.
Okay, Afya Fitness 20 healthcare initiative is dedicated in promoting healthcare access to especially the vulnerable, the school children, and the community. You realize that Constitution of Kenya, Article 43, they say that a citizen has a right to attain the highest healthcare, the highest standard of healthcare service. You see, and you realize that Kenya is having universal health coverage, and also is aiming at attaining the standard development goal number 3, which is health and well-being. That is according to the vision 2030. So looking at those factors, I want to help, you know, and by the time by me helping, you know, I'm still a student, I don't have that financial muscle to do a lot of activities. So the best I can do is to, as long as you have your phone, or as long as I can reach to you, I'll tell you about what you're supposed to do. And while I was in Busia County, I was working to schools. You see, I was working to schools and advising the students and the pupils on matters to deal with health.
Are you doing this alone, or do you have a team with you?
Okay, I have a team.
Okay.
I have a team. So, but the team is coming in after I have formed it.
All right.
Yeah.
Sure.
And when I came to here to Kenyatta University, during the menstruation health hygiene, that was 26th of May, I went to Gladys Girls High School, that is in Githurai 44, and I worked with my team of medical students that are doing medicine and surgery, and we went there and sensitized girls on menstruation, health, and hygiene, and even donated some pads to them. It was actually a very good event. Now, you realize that this, when I talk about vulnerable, I'm not meaning that people maybe who are, or what vulnerable can mean. Vulnerability in my context is people who may not have the chance to get a health information as to the others. And this includes people maybe in the school children. You know, school children are just playing, they don't know what is happening around the ecosystem. So I help them understand what is supposed to be done. And I'm not dealing with precisely health alone, because you realize at Fitness 20, I'm dealing with 3 things. That is health, lifestyle, and mental health, mental wellness or mental health.
All right.
So for the health part, because I'm aspiring to, or I'm to be a medic or a medical professional, so I really want to help my people. You know, they have educated me, so I want to give it
also
back.
Educate them. Right. That's a very good way to put it there. On they educated you, and now you're educating them.
I'm educating them.
Right.
So you realize that I've been doing this for now 3 years since COVID-19, and it has been a lot of challenges. At one point I felt like I should give up because it was not bringing any money. But until I fought that idea, actually, that money should not be a first priority when you are setting up your idea or when you are setting up something that has a long-term goal. So I put money aside, and what I put in front is the healthcare priority of the people, and that's what I've been doing as of now.
All right, very commendable job there, Afya Fitness 20 Healthcare Initiative. And now we are going to have a discussion here this morning with a reverend, and this is going to be on men's mental health. This is a month where mental health of men is taken a look at, and awareness is spread. A few days ago, it was Father's Day. In November, it is there's a day for World's Men Day. I think Men's International Day, and that is also a month to ensure that we are also sensitizing men's mental health. So these 2 months are really important. Now, for Afya Fitness 20 Healthcare Initiative, I see you are also focusing, as you said, the third pillar being mental health. And we're speaking to business people, right? We're speaking to young people who are trying to get jobs. We're speaking to young people who are going to work, who are starting out in life, mostly on this Biashara Tuesday show. Adjusting their lifestyle, I think, is really important, and I'm hoping that everyone who's been watching the show has taken a few notes here and there. They've seen that it's we need a future generation to raise revenue and to run the country and to pay taxes, and to have future leaders as well. Mental health, how does it come in Afya Fitness, and in what areas have you been focusing so far, and what can you inform us about the status of mental health amongst men?
Yeah, I'll start by saying I like what the former president of Kenya, that is Uhuru Muigai Kenyatta, said on 56th Madaraka Day, that was 2019 in Narok. So he said that depression has become a normal thing, that it has become like a day-to-day issue. And he was saying that the employers should actually take or invest more in their workers or in their employees, and he directed the Ministry of Health in conjunction with the county governments and the Ministry of Education, Ministry of Youth and Gender Affairs to look into that issue. That was 2019. So in 2020, the report came out. The report came out of this mental health, and actually it suggested that mental ill health, is a national disaster, or I can say national disaster in emergency, in public health emergency. And also you realize that the report that was given by WHO in 2017, it shows that Kenya is 5th country in Africa recording highest number of depression and suicides. Depression is just related to suicides.
That's a very sad state and position we find ourselves in.
You look at the mental health action plan that was released now in 2021, actually confirms and says that it is not only depression but also drug and substance abuse. So you realize that mental health, first of all, if you see that person being in mental health, there must be something that has led him or her to do that. And for you to deal with the message, you first of all have to understand the messenger and the message, you see? So Afya Fitness 20 Healthcare as an initiative is actually championing for people to have that mental health stability, because it is fitness when you're actually mental fit. I like what Rashid Aman said, the former health CS, said health without mental health is nothing. You see, actually when you look at the 4 pillars of well-being, that is health, we have physical health, mental health, we have spiritual, and then we have I just forgot, but there are 4. So in those pillars of well-being. When you lack mental health, you have lost everything. Even if you own billions and billions of money, but your mental health is compromised, it means nothing.
Right.
So that's what Afefiness is coming in, to champion people to talk about or to speak out. You know, I've been going to schools and I've been advising students and people, speak out. You know what is happening? These children could be going through gender-based violences or rape, even defilement. And then the perpetrator said that when you try to raise your mouth about this issue, I will kill you.
It's going to be worse. So
that kid, you know, stays, it eats down, and then what happens? Maybe he or she can commit suicide. But I say, you come out and speak. Constitution protects you. Because Constitution in a Sexual Act 206, it actually outlines what's supposed to be done. Nandomana, mimi kama as a medical lab profession to be, you know, people, especially ladies who have been defiled and who have been raped, the first thing, they are supposed to be taken to hospital. You know, reporting to police can come later, but first of all, deal with the medical issue. And they come to the lab, we will collect their samples for certain types of tests, and that includes hepatitis, HIV. We also do swab to see if they're actually the guy or ejaculated, or to help minimize the risks of pregnancy. Now, when they come to the lab, we are the guys that will help this person, because when I give a wrong report, this girl will not be helped. But when I give a correct report, this girl. So I tell them, first of all, seek medical help, because Constitution, that Act, Sexual Act 206, says that you are not supposed to pay even a cent when you have been defiled or raped. It is actually free in any public. So perhaps to someone who doesn't know about that information, I'm telling you to know, if you are raped or if you are defiled, the first thing you're supposed to do, seek medical attention. Go the way you are. Do not take off your clothes, or do not wash your hands, or do not take shower. Go the way you are. And the Constitution protects you, and no public hospital or facility will charge you even a single cent. And the good thing, you'll be given a post-exposure prophylaxis for HIV. It is actually free.
All right.
Yeah.
That's a good provision there by the Constitution, but I'm hoping that that is the actual situation on the ground. Knowing how, you know, most of our public institutions are known to be, I'm hoping that, you know, victims actually are getting the same help on the ground as they're getting it on paper in the Constitution. But to wrap it up, Isaac, I think we've had a very informative discussion, even from the comments that we're receiving here so far. Let me just, I can take a look at those later and get to see what people are saying as they come in on KUTV. I see there is Like It. Interesting that they're called Like It. Watching from Nairobi, this is a very sensitive topic. Good job, Isaac Ogutu. It's sensitive, but it's important for us to break it down here for everyone to be aware of mental health, physical health, and also, you know, lifestyle adjustments to ensure that some of these non-communicable diseases, which have been the main conversation for us this morning with Isaac, are prevented. The people of God are watching from Nairobi. I want to know if the people of God is one person or those are several people, but thank you for tuning in, the people of God. When we are speaking about mental health, maybe just to wrap it up and tie it down with the rest of these lifestyle diseases, non-communicable diseases that we've mentioned, like hypertension and diabetes. When you're in a very stressful situation, how does this affect maybe your cardiovascular activity? Is there a way that mental health, I know earlier you mentioned smoking, drinking, pathetic dieting, and physical inactivity. Does mental strain also lead to some of these NCTs?
Yeah, there's a relation, actually is very much evident. For example, you realize that when you are stressed, you don't take food. Actually, most people, they don't take food. A small population will overeat but a very good population will just say.
And sometimes if they overeat, it's junk food still.
Yes, exactly. So if someone overeats because of stress, it is junky food that you're taking in. It will actually lead to a certain. And if you are not taking food, some people, they tell themselves, oh, nikona stress, I can now take alcohol, I think bangi, nituliza, and so on. But now you are taking alcohol on an empty stomach. You see? So what it will now lead to you, that is an empty calorie that you are taking in your body. And apart from injuring your esophagus and your stomach, alcohol constricts the blood vessel. Constriction means if this is your blood vessel, alcohol will make it shrink. When it makes that shrink, it means that your heart needs to pump blood with a lot of pressure in order maybe to accommodate that stimulus. And then you realize that over time you will start developing hypertension. And you realize that if we say stress, we are not meaning that the situation where you are thinking a lot. We realize that stress is a stimulus, a stimuli, something that is provoking you to do something, to think, to act, or to feel something. Thinking part of it is cognitive, feeling part of it is kind of emotion, and acting part of it is physical. Because what you might be going through is subjective. You can be actually okay, but inside you are not
really
okay. I can see you are okay, but inside you are not okay. So it is subjective. So when you realize that stress and all these things, at the end of the day, they can actually lead you to non-communicable diseases.
Thank you so much, Isaac. This has been a very educative conversation, and I've enjoyed it myself. I'm hoping that everyone who's watching at home has actually enjoyed that as well. And this has been a conversation on NCDs, and we are trying to ensure that non-communicable diseases are not something that you're grappling with. With the current health situation in the Republic, it is important you stay away from hospitals if you can, as much as possible. That has been Isaac Oguta, and I think he just grabbed something here for me to have a look at. I'd love to know. You can tell us what this is.
This is my T-shirt. I think this is my second T-shirt. The guy who brands it for me is called Chris, CEO Brandvik. It's just here at Kenyatta Market. Yeah, if you want connection for branding, I can actually link you.
Okay.
He has been printing my T-shirt since 2021, and this is my actual T-shirt. And even I have a banner of which I just forgot to carry it. So I do this T-shirt for promotion. You see, when I sensitize people to things to do with health and mental health and lifestyle, actually when someone can see this is a fitness, and you see this is the back and this is the front.
Okay. All right.
So this back, it is written the #1 healthcare service provider.
And the website there, people can be checking that out, afterfitness20.com.
The website and our social media handles.
Okay.
So when you cannot receive that healthcare service maybe in a hospital, we are here for you.
All right.
Hospitals, because first of all, you realize that when you look at this logo, I'm dealing with quality, affordable, and trusted
healthcare.
Affordability comes with cost. If you cannot afford, we can actually help you. I'm looking to be in that position where I can help you. And we're also dealing with quality. When you don't have money and you are sick, and comparing to someone who has money and he's sick, I think the guy with money will be given the first priority.
Quality, right.
And then trusted, I'm a medical profession.
Right.
In
From
the next
University.
coming months, I'll have graduated. So by that time, it will now be a trusted because you are actually dealing with a health expert who understands what is going on.
After Fitness 20, Isaac Ogutu, thank you very much for joining us here this morning. Biashara Tuesday takes a short break. I'll be sampling on Twitter on the hashtag Biashara Tuesday at KUTV Kenya and also at Richard_Kenya. Where can people get these T-shirts, or these are just for the patients that you will be taking care of?
I think I'm rolling out a strategy in maybe next month. I've sold a number of them. Yeah, but the stock is, I think, limited. Next month, I'll produce another batch, of which I'll be giving out.
Keep tabs on their social media handles, and you'll get more information We'll be right back after this.
Thank you.
Are you an aspiring media practitioner, a graduate, or you just want to advance your skills in television production? Then welcome to Kenyatta University, where education meets innovation. KUTV, the premier university television station in Kenya, is now offering short courses in TV studio, field technical operations, and video editing. Through these courses, you will acquire hands-on skills on camera operations, media production, lighting techniques, audiovisual editing, and sound and visual control, and how to operate key equipment in modern TV control room. Enroll today at KUTV and discover your full potential in cutting-edge TV broadcasting. Graduates of these courses will receive professional certificates. For more information, visit our offices at KUTV Studios or call us on 020-870-4252 or 020-870-4255 or SMS us on 0739-110-544. KUTV, a new experience.
Approximately 400,000 women in Kenya suffer from symptomatic uterine fibroids. A fibroid is a non-cancerous growth that develops in the uterus in women during their childbearing ages.
Yeah, so if someone has never been pregnant with a pregnancy that went to 20 weeks and beyond, they've been found to be more predisposed to getting uterine fibroids. Also, the black race. Yeah, being black is a risk factor as compared to the whites and Caucasians. Blacks have been found to get fibroids more frequently.
Uterine fibroids is manageable and preventable, and we should seek medical advice as soon as possible.
Access to knowledge. Solution to unanswered questions.
Guidelines to pursuing your rights and repossessing your property, intellectual or material.
This and more only on Law Matters.
Technology, science, innovation, ICT, and research. These are the ingredients upon which the solutions to the 21st century problems are founded. In a world that is rapidly changing, it's all hands on deck to ensure a balance in all fields of life. Women, young and old, are also in the front line, breaking the glass ceiling, becoming thought leaders in the larger tech space. Not forgetting other societies marginalized. And when the tech Avengers come together, we inch closer to a much safer, efficient, and sustainable world. What we view as a norm in today's advanced world was just an idea, and for nostalgic reasons, we trace back to the iconic days to bring you the retro tech. On Tech Innovation Show, we encapsulate all the pillars of the fourth industrial revolution, decoded in a language, all for one for all. Every Monday at 8:30 as we push the mantra, keep learning something new each and every day. Only on KUTV, a new experience.
seeing the impacts of climate change. In Kenya, for example, the frequency of the floods is becoming more and worse. The amount of people and livestock we're losing.
The level we need to go is a level where the normal mwananchi and also the government stakeholders can uptake these solutions.
Those small acts multiplied by millions of us will help make a difference in the world at the end of the day.
It's just a slight behavior change that we need, and you'll find that it serves us a bit more than you put in. And that's the goal. We want to live a better world than we found. Because at the rate we are going, it's dire.
We will secure the planet for future generations.
To the Church O'Clock Show. I'm your host, Esther Becky.
And my name is DJ Terrell.
We start you off with a word of prayer and get you started with a live transformational worship experience. And have our minds renewed by the word of God on the word segment.
And not forgetting new music za hii wiki, yani ndakuwa bado nawapatia pale wasanii wamekuwa kiwakali. So make sure manzo tune in because zitakuwa zina flow pia pale mixes kwa wingi, yani zitakuwa zina come through, and pia performance yani from our gospel artist hapa on Gospel Art
from 7 to
10 a.m. only on KUTV.
Maelfu na maelfu ya wahamiaji wakiwa na watoto kutoka nchi za Amerika ya Kati wanaendelea kuwasili kwenye mpaka kati ya Marekani na Mexico.
But folks, I'm going. Thank you very, very much. I appreciate it. Thank you.
Ni habari kutoka pembe zote duniani.
Pepo pasi vuguvugu. Pepo pa ni idea.
Sazidi ananyonya, hanyonyi vizuri, anakuwa hayuko comfortable.
Jeshi la Jamhuri ya Kidemokrasia ya Kongo linapambana na waasi wa ADF.
Kwa sasa wanatoa wito kwa mashirika, makampuni na vile vituo vya uchukuzi.
Mambo mengi yatakwenda kama yalivyopangwa.
Hapa ni kuna mmoja wa viongozi wa chama cha wavuvi katika eneo hili.
Zaidi tunajaribu kuwapa chanjo ili ina boost ama inanyanyua kinga ya mwili, ndio inaenda kupelekea kupambana na virusi.
Ni duniani leo, Jumatatu mpaka Ijumaa, moja kwa moja kutoka VOA Swahili, Washington DC.
Mama
Right, mental health is a massive area of concern around the world. Kenya, as we just discussed there with Isaac Ogutu, was ranked recently 4th in Africa with 1.9 million people with mental illnesses. Depression is the most common mental illness, and men are actually affected a lot. Data from the World Bank here puts suicide mortality rates in Kenya at 6.1 people in every 100,000. So 6 people in every 100,000 commit suicide, with men being in the highest in this category. 9 men in every 100,000 of these are affected. So men are the largest or are the biggest demographic which is affected by issues of mental illness. There's a growing alarm in suicide rates in Kenya, and the biggest of it all is men. You can check out a couple of documentaries, including from the BBC, that are detailing exactly how dire situation is in the Republic. So where should we pick our lessons from? Should we get them from the past, where we know our ancestors were strong men, or even way back before that when we were hunters and gatherers and we didn't have much to think about all the time, and hence did we have better mental health then? How can we manage our mental health as men, especially in this current generation? Reverend Eddie Waiguru is going to be here with me. He's a CEO and founder, a professional mediator who's offering alternative dispute resolution methods as well. He's well versed in philosophy, theology, a great traveler, well exposed. Who other than him to put this conversation into perspective this morning, as we try and take a look at this month, which is also part of a month to raise awareness in mental health amongst men. Last month was generally us looking at mental health in the population. We're narrowing it down this month to take a look at how men are faring on in our midst. And following up on that, I went down to the streets last week, asked people a few questions, and they were young men. How are they feeling? How are they mentally? Some of these answers will put you in a state of contemplation. How is the cost of living affecting their mental health? Let's have a look at the answers.
I was not aware, but now I know it. Thanks, by the way.
Is it June? Really?
Yes, this month.
Is it June ama ilikuwa last month?
I didn't even know there's something like that. It immense. Hey, no, I didn't.
Hizo vitu watuangaliangi juu hata siku hizi bei ya kalenda manze imepanda.
I didn't. Actually, I know you asked that before, but for real, I didn't. And that was like, I felt bad about it because this is about us and I don't know about it. Yeah.
I think I'm very stable, strong man. I do take care of myself. Spendi drama hivi kidogo kidogo, so niko fiti. Situmii kale kaboza. Na kamunyweso ni X, so I'm fit.
Sai, nikidhani niko unstable kiasi.
Mazi. Currently, I'm okay.
You're okay?
Yeah, I'm well. Okay, though we can't say, you can't generalize mental health for the whole month, say I'm okay, because there are those times utapitia some other things and kidogo it's a bit shaky, but currently I'm good.
Mental health yangu iko sawa. Do I feel niko depressed kiasi?
I have no stress, no nothing. Yeah. Hey, but the budget, yeah. The budget is stressing me.
Financially, it's struggling.
By the way, I'm a father of one, and high cost of living, and we are talking about 16% VAT. So kuna school fees hapo, kuna travel, kuna hao, najua landlord pia ana watch because kuna kakitu kanamguza. So hiyo kitu ni noma sana, especially kuweka food on table. Crisis. Crazy.
Sasa 7 nilikuwa na 50k, sasa niko na 20k bana. 30k imepotea hivyo. Mwanzo hiyo ni stress bana.
Yeah, to some degree, yes, because you have to sort some bills. But also you need to understand that change is inevitable. So at least una try to boost mind yako na kuiambia, yo bro, you know how hata kama cost of living iko high, you need to at least adapt. But yeah, nikugori mtu yangu, tricky.
Hapo sana mazi. Life ni noma sahi, life iko hard.
So mazee inatu affect performance ya mentality mazee na kuwa ngori kiasi.
Vitu saizi mahaiku bei sana. Napata humu napigwa pressure na familia. Kama mimi niko na wife, niko na mtoi. Watu wanadepend on me. Kitambo ile shopping nilikuwa na spend ya dhao, sasa imekuwa minimum sana. Sasa na spend kama 3-5 ndio niweze kunini kuwa feed. Naona after na kwa inafanyia kazi bado sijaongeza hiyo salary. So naona inakuwa pressed sana.
Men are the breadwinners, so you're expected to come with something at the end of the day. And just imagine, bro, you're walking home, you don't have nothing in your hands, or what you have is not enough, and there is the kid, she needs school fees or he needs school fees, you have bills to sort, you have a wife or maybe kwata na mama, and the bills are not adding up. So this at the end of the day will pile up in your head. And you know, our African societies, or generally men, have been conditioned not to talk. You're conditioned to be like, as a man, I have to be strong, I have to be strong. That's the mantra. But until when? How strong are we at the end of the day? So I feel like it's a little burdening for the men and the boy child as well.
Okay, I'm having a side chat here with the Reverend already. He's on the show, and we are discussing men's mental health. That's a sample of a few young men that we spoke to last week in the streets, and you know, getting to hear what their mental health status is and how they are reacting to the cost of living. Some of them, as you've heard, they've even admitted on that video, Reverend, I'm sure you've watched it as well, they're saying that, you know, they're depressed. Some of them, their mental status isn't in a good place. Some are in a good place, but the budget and the cost of living is, you know, a bit tricky. So some days are good, some days are not good. And that's the conversation we're having here this morning. Welcome to Biashara Tuesday. If you've not been joining us, thank you for your time right now on social media. Please continue engaging us on the social handles that are displayed somewhere there on the screen. We'll be getting to look at your feedback and your reaction. If you're a man out there, please take a second and tell us, how is your mental health and how are you doing about it? What is the cost of living? How is the cost of living affecting your mental health? If it is, please do inform us, and we'll be glad to read that to the rest of our viewers. But first, before we get ahead of ourselves in this conversation, karibu to the show, Reverend.
Thank you very much.
Very glad to have you here.
Glad to be here again.
All right.
Yeah.
How are you doing mentally?
I'm doing fine, quite well. I think this is one of my best time being here, because my last weekend was one of the best. I just received a great friend, one of my mentor, and a father from the US, and we spent like a week together. His name is Father Coffrin, and so I feel so good. Like even celebrating Father's Day, you know, we just had Father's Day on Sunday.
All right.
So I'm a proud father of 3.
Congratulations to that.
Thank you.
And happy belated Father's Day.
Yes.
All right, welcome to the show. Please introduce yourself to the viewers who might not be aware of who you are.
My viewers, good morning, Kenya. My name is Reverend Eddie Gadangi Waiguru, here from Githunguri. I know Githunguri is hitting news nowadays, and I would say, I'll start even by saying we are proud of our place. As my good brother here had said about my profile, I do mediation. I have a program that is helping the young people, especially empowering them, giving hope to those who are getting depressed, or even opportunities if they are there to have some jobs. So that's all we do. We also do ministry, helping people, because when somebody has a vacuum in him, especially the spiritual part of yourself, if it's empty, you realize that many things will go wrong. So I think that is one of the areas that is making our young people really get into all those issues. We have had them talk because many of them have stopped going to church. They have stopped thinking of their spiritual part.
All right. Looking at that video, which we just sampling a few views from men out there in the streets, most of the issues they point out when they are saying they're not well mentally are financial. You ask someone, how are you doing mentally? Asema niko na stress ina pesa. Financially I'm struggling. I realize it's mostly around economic activities. Is this the case? Is men's mental health, you think, mostly affected by their economic situation, or there are other factors maybe that contributing to that as well?
Very, very true. Money could be one of the factor, but for me, it's not even somewhere in the primary factors, and I would say that is what has been taught to us, even when we were growing up. Not when we were growing up. When we have grown up and we used to go to the schools, I used to realize something that was those days. I used to feel so bad. And this has come to reality. You know, when I was in primary school, we used to go and enjoy games, play football, or in other language, soccer, and other games. And we used to enjoy ourselves very much. We would get back into the class sweating, not even minding. But today, or several years back, you go back to school, to those primary school, and you find kids playing football, but wamekelea, kila mtu ametoa pesa. When you win, they take the money. So I said, no, this is...
it has lost the joy.
Yes, it has lost the joy. And I think that has also introduced now people to think life is all about money.
Okay.
Yeah, I have interacted with many friends, many people, and even in my own family, the first thing they ask is, how much are you making? Like even as you are doing the other show with the other gentleman, Mr. Gutu, and I really appreciate the first show since it has lessened most of the things
that you are going to
ameelezea mambo ya mental health now in a scientific way. So now we don't have to dwell very much into that.
Science.
So I was with a gentleman, I think he's coming next, and we were trying to say what motivates you, what brings you, makes you alive every day. And many people would say, I'm waking up to go and look for some extra coin, some extra money. But I think if you do that, especially today when there is no money, even the government, the executives
has no money.
They say, so I think we should change that. It's not easy, but if we do deal with these two things, and this is what I brought to this show today, about the issue of hopelessness. So if you don't have hope, you are hopeless. And then the issue of being impatient. So those are the two main areas that I would love us to share with my other comrades, the other men, that when you lose hope, even when you are going to look for that money, hautafanya nini? It even runs away from you. But if you hope for something that today I wake up, I prepare myself, I'm going to meet this kind of a person, I'm going to kutegea mahali, maybe kwa joint, na uko na hope, where in your mind it's hope, I think things will come up. And then the issue of patience.
All right.
As you said about traditionally, we have to base ourselves where we have come from, where we are heading to.
Yes.
We used to realize that those years when we were very young and before, many things didn't have to happen in a single second. Like today, if you want to put on lights, you just go to the wall and
switch it on,
and
switch
the whole building
is lit.
But when we were growing up, when we were very young, you had to do a lot to have
the whole process.
The whole process. Hata kama wengine they used to use the fire. Kabla hiyo moto iwake, even the days before there hakukuwa na kiberiti. So before upige hiyo that stick, and then and all the issues, maji even the water. People used to
have
go,
instant showers.
Yes, they used to go very far to the river. So there was that concept. You are being prepared that nothing comes easy. So you are able to be patient. But today, because of how we have been brought up now, this generation is mnajiita generation Z.
Tunajiita.
For me, I'm even
TikTok generation.
For me, I'm even telling saying in quotes, and forgive me for this.
It's okay.
Z is the last, the last
letter in the alphabet.
In the alphabet. So I think it's also the last generation that has all these problems.
Yes,
I have
that's a
hope.
positive note.
Okay.
You have hope that
the hope is the other generation after Z is Alpha, and Alpha is bringing up new things. So all these problems we are having, we will not have them with the Alpha generation.
Inshallah.
Yes.
That we shall get there. Now, you've said that we need to pick a few things, yeah?
Yes.
Including patience from, where we've come from, how our ancestors, our forefathers were like, nothing comes easy.
Yes.
Are we saying that now men have lost hope and patience in this current era?
Very, very true. That you want something now. If you're going to look for a job, you want, when immediately somebody gives you a job, even before you do the work, you have what? You have the money. I have
deposit kidogo.
And this has even given myself a lot of problem since I've been in the school most of my life, almost 3/4 of my life, just in the last few, maybe 3-4 years. And getting even into employment is very hard. So when you go out, you spend the day looking for what to do and what. And when you come back home, the first question, how much
have you made?
Now you ask. The money does not just come. You see, the concept people have about money, that you have to come back with it. So for me, about that issue of having hope, like whatever I do for those years, I believe it has been like planting a seed. Unaona, but si ile kanisa ya kupanda mbegu. This is you believe that any person you meet, even if you go to an interview, and whether you get it or not, just know that you have planted what?
A seed.
And just like any other seed, when you put it, you cover it. It dies for some time before it shoots. So I believe for those years, I have been planting what? A seed, and it will grow. And when a seed, the more time it takes, the better and the sweeter the fruit, and the longer you enjoy. You cannot compare a seed of a corn or maize and a seed of a mango, a mango seed. A mango seed will take a lot of time to sprout. But then you enjoy mangoes for many, and they are sweet. But for maize or bean, it just grows after 2 days.
Fast, and hakuna mtu anataka mambo ya githeri after 2 days.
That's it.
Yeah.
So that's my encouragement to young men, that the more the seed stays, the better, and how the future will be sweet.
Right. These days they call it nyota. So kama nyota yako bado haijaonekana, maybe it's your seed that is taking time. Don't be a mango seed that is looking at the maize seed and wondering why mine isn't sprouting up yet. When we're speaking about hope and putting it into context with the current events in the Republic, I wanted us to talk about theology a little bit later.
Okay.
But let me just let's tease it there a bit.
Okay.
We've seen a couple of guys, not a couple, hundreds of people who have recently been found in a very tricky spiritual situation over in the coastal region, where some of them have starved to death. Some of them, they were seeking God. They were seeking hope beyond the current lifetime. What does this picture paint for you in terms of the mental health condition? Is it somehow related, or how does now the spiritual part of mental health come into play?
Great. And to answer this, allow me to also quote a great friend. Kwa social media sana, one of the pastors anakotiwa sana is Pastor T.
Pastor T.
And he once said that whoever manages the young generation has the future at hand. So if you manage the young generation, you have what?
The future
at hand. And I see, when I take that concept, I relate it to what I have learned from other religions, like the Chinese, the Hinduism. Those people, they have a concept of forever. Life will continue even after 500 years. So you see your life not today, but 100 years to come. And that's why they are very innovative. They grow, they develop, because they are not just seeing today or tomorrow. They are seeing life beyond, even beyond ourselves. But what has been brought to us now as Christians is every time we are being told, when you go to church, pray as if this is your last
time.
Your last time. When you are praising, when you are dancing, do it as if it's your last time. So we have never been given, in our minds, we have never been told about preparing for our future here on earth, because God brought us here for a purpose, and He wants us to prosper, to live a fulfilled life. But when we have other people like pastors coming to just tell you about today, and tomorrow anything can happen today, and tomorrow you are dead, you're going to meet your creator, right, or your tormentor, Satan. So that one even makes you not even to think, because all you are thinking about, sasa nikikutana na Mungu ama nikiwekwa kwa shetani,
leo ndio siku ya mwisho.
Ndio. So I think that's one of the thing. If we can remove that from our minds, that just live. God gave you this life to come and live here on earth. When it is your time to live, atakuchukua. So stop thinking about what will happen when the day you will die. Yeah, just like myself, I even give myself I have a life plan of 150 years.
That's a long plan.
Yes. So I believe, and I know one time we will come in such a show.
Yeah, in 200 years.
No. Whichever year. But this is even not taking long.
Okay.
I'm very sure I'm going to see a united African continent without boundaries.
All right.
That I just came from the US, and I was privileged to drive myself. I came from the last state in Maine, went through, although I used to have several stopovers, I've driven from the last state, Maine, all the way to Seattle, the other side.
How many hours is that kind of journey?
Okay, it can take several days, not even hours, but I would take even like a month or two, because when you get to a certain state, you have some Kenyan friends, they would invite you, host you for a couple of days, some even a couple of weeks. Other state, I would go and maybe use the phone, Google. I see some shelters where homeless people do, and I would just go and pretend to be one of them. And I would stay in a shelter, those people of homeless, and be with them. And that's where I got my my eyes open, and I realized that's where even after going all those studies, philosophy, theology, I thought it was studying to know about God. But when I stayed with those homeless in the shelters, that's when I realized where God lives.
All right.
Yes.
That's a profound statement.
So my answer to that question is, all these issues, Shakahola and what, is because of wrong doctrines.
Wrong doctrines.
Yes. My answer is, you are born, you are created, you are brought into this world, just relax. Let God take control. He created you for a good reason. He has a good purpose for you, to prosper you, to take you to greater heights.
Yeah. Live and let live. I think that's how they usually put it. Let's get back to, you said we call ourselves Gen Z, right? And some say it's the TikTok generation. Before there was a .com one, I think it's the one that's birthed the new TikTok generation and Gen Z. Is social media a part of challenges that men are going through in terms of mental health? Maybe, I'm seeing Reverend Eddie was just last month in Maine driving across 50 states. Na mimi niko hapa Kihunguru. And I'm looking through his social media. Do you think social media has also contributed towards this fire?
Yes, a lot. And even in my interaction with many Kenyans abroad, I realized these cases we are seeing here, they are also there. We have had many people committing suicide, very many people even getting depressed, dying, and others being even deported to their country just because of that. Social media, you are seeing not just the people you live with, even like you went to the US and you are looking back to your classmates here in Kenya, and you see somebody has put up a house, has bought a nice car, and you are still there hustling, because life is not just very easy. Also on the other side, so it has contributed. It's a great factor to that. And other things, allow me to just produce through some of the few issues that has escalated the issue of mental health.
Okay.
And the first one, I would start with the upbringing, the upbringing of our kids. And I was sharing with some other visitors who had come home with the Gen Z that they have been brought up by this generation Y. I see myself as Y. Hata kama watu wengine wanaona ni kama mimi kijana, mimi mzee.
Wewe ni mzee.
So I tell them because of what we went through, the upbringing we were brought, we were really tulikuwa tunachapwa nini hash kuambua endea maji huko mtoni kuchuna kahawa, but after now we didn't want our kids to go through the same. So we have given our kids everything they need. So akitaka kitu mkipita kutu kwa shopping, I need this, ukitaka phone, take this. So everything is very, very easy. We have employed house helps for them, the nannies. So for them, it's just
life is a breeze.
So when somebody ended through the school, primary school, secondary school, even campus, and now he's on his own, anashindwa, I thought life would be like the way I was brought up. So immediately that thing takes you immediately to the mental disorder, because now you don't know where to start. You cannot even clean your own clothes. You cannot cook for yourself. So that's one of the great things. And also the issue of as we are talking about parenting, parenting has also played a big role, and we are seeing the rise of absentee. I know a day will not end without you hearing somebody saying baby daddy,
absentee fathers,
baby mama. I think that's one of the things also that has been glorified even by churches. So unfortunate, but it was not the will of God. And that's why even when Jesus was being born, God made sure that there was a father figure for him. Even if Jesus was born through the Holy Spirit, but there was Joseph. You see?
Father figure.
The father figure is very, very important. And I was just hearing somebody says that father-son relationship is very important. And if it lacks, it can cause a lot of pain. So most of the people who are going through a lot of pain is because they lacked that father figure. Not necessarily to have a father, because there are those who, but a father figure. You can have maybe an uncle, or maybe you are a woman, you have your brothers. You should let your brothers just be free with your kids. Let them
play a fatherly role.
Let them play their fatherly role. Even if it is some discipline, don't fear. Don't even go to tell, hey, you do you think these are not your kids? You see, because some of these Generation Z, they are very protective to their kids, but they think they are helping them. In a way, they are just spoiling them. That's why we are seeing even the cases of suicide increasing from people who are very young. You would be surprised the number of suicide cases in primary school is in another rise. Unashindwa mtoto hata amefikiriaje mambo ya
suicide, anajuaje vile inafanywa,
si ndio hiyo? So that's why I would say that's one of the thing. The other one is poverty. I won't explain much. That's hiyo ni kitu kila mtu anaelewa. Wakati wa campaign or before, just a few years ago, tulikuwa tumesikia hiyo narrative ya mambo ya dynasty na hasara na nini, but I'm seeing now people are becoming one. You're talking one language of poverty. Tunaumia sote. Na mimi nafikiria it's a way, hata tunaambiwa gold passes through fire. So we are
being refined.
We are being refined. So whatever will come out after this is super. So that's poverty. The other one is about social media. You mentioned, I was sharing with you, I had yesterday, nikiwa kwa kinyozi, nikasikia news jioni, wakisema kuna news that they are soon coming to be a solar internet eclipse. Naona venye sometime hakunanga light nights during the day because something has blocked this sun and moon earth. And the earth. So imagine an internet eclipse. So, and they were saying like for 6 months without internet. Can you survive?
That would be depressing for a lot of the Gen Z. Yeah, it could be everyone. I don't think I would survive because most of my life, I think 70% or so is based off all around the internet.
Yes. And I want to share something a bit humorous. I don't know how you take it. That,
it's okay, do it.
Yeah, that even sharing from those young people and the issue of internet connectivity, networking. So I would say God first of all gave us a very nice network. Unaona network. Na akatupatia area mzuri sana. And the areas, nimekwambia nilikuwa kinyozi. I know many people would wonder, no, I see.
Ulikuwa unafanya nini? Ama wewe unanyoa, wewe ndio unanyoa.
So nataka kuambia ukiangalia historia wenye wameongea those young people. Anyone who is completely shaved anaongea mambo ya shida. Yeah, because amekata nini?
Ameshakata nywele sasa.
Area network.
In your area.
Inashikanisha inafanya it can also help the issue of mental health. Those people who are really positive and they were seeing things that people are, unaona akona dread, akona nywele, unaona hata
mimi. So mimi ni mtu positive sana.
That's it. So that's something.
That's one of those.
You know, there are people who came and told us, if you want to be smart, if you want to be, you have to clean everything.
Clean head.
But they had a motive. They wanted, because unaona hata mtu akifanya makosa, when you are put into jail, the first thing, yes, so that you don't think right, think straight. So shaving your hair has also contributed. And I have also liked the narratives, and there are people who have even gone to the media, even to courts, to say that even in schools, people should be allowed to
have hair,
to keep their hair. Why do you think other races
have been keeping
have kept their hair? Because it's very important. Mungu hakuiweka just for that.
Ndio maana walinyoa Samson ndio waweze kumvuruga.
Yeah. So tumalizie the other things, peer pressure hiyo tumeongea, like you are measuring your life about the other people. Unaona venye wanaendelea na wewe uendelee, unaanza kuwa depressed, unaanza kujidharau. The issue of divorces, they are in increase. And why? Maybe that will be a topic of another day.
Yes.
And then the issue of deaths, zime increase sana. People are just getting into the deaths.
Right.
Yeah.
Now, Reverend, let's speak about Mama Ubuntu.
Yes.
How does that play in now in terms of helping people and also a bit of mental health?
Okay. Great. So as I said, we have a program called MOUSE. MOUSE is Mama Africa Ubuntu Shelter. As you have heard, it's about a mother, a place where, you know, a home can never be a home without a mother. People may even make jokes that if you find a husband or a man in the house and you immediately you get in, he akikusalimia anakwambia karibu sana, lakini the owners are not not around because a mother is a very important aspect in a home. And then Africa, as I said, one of the reasons why we have remained as developing of poor nations is because of lack of that unity. We need to be really united. And so I see a future where we will be one, that you can even, you don't have to, your mind can think, after I finish school, I'm going to settle in maybe Kampala, in Lagos, in South Africa. You see, when your mind is like that, you even this issue of mental health, you won't even have time to think about the suffering. You are thinking, when will I travel to that other country? What are the opportunities in those other countries? So that's why that issue of Ubuntu and Africanism is coming from. Right. Ubuntu is the issue of living together, together as the way the people lived in the village. They used to share, hata kama hauna sukari kwako na kuja na kuomba, although sijui kama leo una mtu anaweza kupea sukari.
Some help.
Yeah. So that's it. And it provides shelters for the homeless, the rejected, and those in need of strategizing their life. You know, we bring people who the government has done something good to regulate and do this issue of the fight about illicit brew. They have closed those bars. Vijana used to go in the morning, but the question is, now you go to the street and you find men just there seated.
Right, that's true.
Yes, they are even at a worse situation than they were before.
In the
because they would leave home, go into those dens, drink, just forget themselves. But now they are there, they are sober, they have nothing to do. Now they start even thinking of even other evil things, going to rob and all this. So we realize there is a big gap in that, and that's why we have this program to empower those youths, to give them skills. Skills like I'm working with another great man who is a great producer in Githunguri town. We used to invite for a seat, MCA seat in Kamba. But I think he was on the wrong side of the politics. He was in Azimio and that, but he would be the best, best candidate. He would by now. I am very sure that area of Kamba and Githunguri as such would be having some industries and job opportunities would be realized. So those are some of them. We are working with him. Another person called Jesse. He helps very many people. He goes around in schools. Empowering young people, telling them about their future, and so I hope you will get a chance to come and talk to them. They are very young, very energetic, good-minded young people.
I hope they're watching the show. I'd love to have them, of course, to come through here. And that's a small brochure there we are showing of your initiative, that is Mouse. And how can people then, people who need help that you've mentioned, the kind of services that you offer, how can they get to you and what can they look forward to?
Okay, thank you very much. So if anyone would want to have those services, if you have young people who have lost hope, if you have young people who are jobless, who have gotten into issue of alcoholism and all those things, reach to us. We are on the ground. First of all, if you come to Githunguri, as I said, is one of the historic place. So even what is happening politically with our MP, going to the parliament, it's not her own making. Yeah, she is representing the real
hustler.
Not used. Let's say Wanjiko.
I thought that's where you're going.
Because that word has
already been gentrified.
Yes.
Okay.
Wanjiko. So we are proud of our MP. Let me say that.
Okay.
And then so we are in Githunguri, a place called Keria, just next to Keria High School. And then we also have an office in Kiambu town, just next to the stage where we have Deacon College. You can meet us, and anyone who want to reach us maybe on phone, I would share the phone number 0743 276628. Other social networks, I go by the name Kunta Kinte. I don't know whether you've ever heard that name.
Yes, this famous live.
Yes, all my not.
King.
Yes, he would call him slave because he refused. He refused to become a slave like every other.
Yeah,
so
that's true.
All my social media, Facebook, Twitter, Instagram, you'll find Kunta Kinte.
Yes.
The second, because the first one was there.
Okay.
So all those, let's connect. Let's join hands. I will call anyone who would really have that vision of helping the young people. Allow me to just share just two people that I had contact with them. And one is our speaker in Kiambu County. When he was vying for the MP, we sat together and he used to give me his four big agenda, the big four. And one of them was the youth and the issue of joblessness and whatever. So I know now that he's in a busy seat, we can also work together. And another one, let me not mention his name, but he's a great presenter in this big media.
Thank you.
Yeah, so thank you very much.
I thought that was me. The big presenter. I took that up.
So he told me he was when he was going to have this celebration of his 16 years in the media industry. And he had a very big ceremony. People came all over the country, politicians, it was during the time. And he told me, come, I want us, after this ceremony, I want to start a foundation that can help the young people. And so maybe along the line, people have different views, advisors. So maybe they told him, don't go that route. Let us look for another route. But I know their hearts, those two people, their hearts are into helping our young people. They are back there in our place in Githunguri, in Kiambu County. So let's all people join hands, our politicians, our women rep. I know he has been to that. That was his campaigning tool. And our local MCA chiefs. This is something we need to join hands. It is not something that can be done by one person. Anyone who has a view, an idea, let's join hands. Because if I have 1 minute, I also work in a transport industry. We have a very good circle in Kiambu town called New Life, and we have a chairman, Mr. Kim. I know he's also watching, and he's helping very many young men. And nowadays, the ladies are even coming into tuk-tuk. If you come to Kiambu, you find many tuk-tuks with women. So this chairman has really organized, and once in a while, he organizes some forums where these drivers can come. They can be talked about alcoholism, about saving, and so he's helping. He's playing his role. And so one time when I was driving, I drive tuk-tuk sometime. So you would be surprised if you're my passenger. And
someday,
I would take some officials to schools who are doing health, going to. And I was surprised when they told me most of the school they would go, they would be taken back. They would be told, no, here we don't. We need this documentation and all. And I asked these school people, instead of realizing what these people have brought, and help and assisting them, if they need any document, they should help them to get that the kids can benefit from these officers who are going. They are volunteering to go to schools and talk to the kids about mental health.
All right. Yes. Thank you very much, Reverend. There was a comment here. Margaret Githui watching from Kirigiti. Great show, listening and learning. Congratulations to Eddie. So those are people who are watching from Kiambu County in Kirigiti. Blair Masharia watching from Kisumu. Shout out to Eddie Waiguru as well. Thank you very much, Reverend Eddie, for creating time for us today.
Okay.
We'll be loving to have you another time. I know time has not been on our side today. It's 9:20 in the morning. There's another conversation coming up on what is happening in the headlines, but some other time we'd love to have you here for some more.
Yes.
Okay.
And this a book I authored in the year 2014. I hope I'll get a new edition so that we can now put in the things of the current affairs. Thank you.
All right.
Yes.
Biashara Tuesday talks a short break. Kimani Wachira, outgoing president of the TVET Student Association, is here already. He has the papers with him, and I also do have my copies. Let's get to know what is happening politically, economically, and also how it will influence Biashara this coming week. Stay tuned.
To the Church O'Clock Show. I'm your host, Esther Becky.
And my name is DJ Terrell.
We start you off with a word of prayer and get you started with a live transformational worship experience. And have our minds renewed by the word of God on the word segment.
And not forgetting new music za hii wiki, yani ndakuwa bado nawapatia pale wasanii wamekuwa kiwakali. So make sure manzo umetune in because zitakuwa zina flow pia pale mixes kwa wingi, yani zitakuwa zina come through, and pia performance yani from our gospel artist hapa on Gospel Art
from 7 to
10 a.m. only on KUTV.
ambayo ukiyasuluhisha unaweza kuathiri watu kwenye bara hili bila woga.
Watu huwa na uzalishaji zaidi, wanajawa na ujasiri, wanakuwa wabunifu na wanakuwa wenye maarifa.
Niliamua kuacha kazi, hata kama sitafanikiwa, nitakuwa nimejaribu, nitakuwa najua haiwezekani.
Hakuna kitu cha ajabu hapa. Kila anayepata ufanisi hufanya kazi usiku na mchana.
Kitu kitakusukuma na kuwezesha kupata maarifa ambayo hukuwa nayo.
Tunajaribu kutengeneza kitu kitakachopita mipaka ya nchi hii.
Ikiwa unataka kubadilisha ulimwengu, anza na nyumbani.
Access to knowledge. Solution to unanswered questions.
Guidelines to pursuing your rights and repossessing your property, intellectual or material.
This and more, only on Law Matters.
Technology, science, innovation, ICT and research. These are the ingredients upon which the solutions to the 21st century problems are founded. In a world that is rapidly changing, it's all hands on deck to ensure a balance in all fields of life. Women, young and old, are also in the front line, breaking the glass ceiling, becoming thought leaders in the larger tech space. Not forgetting other societies marginalized. And when the tech Avengers come together, we inch closer to a much safer, efficient, and sustainable world. What we view as a norm in today's advanced world was just an idea, and for nostalgic reasons, we trace back to the iconic days to bring you the retro tech. On Technovation Show, we encapsulate all the pillars of the fourth industrial revolution, decoded in a language, all for one for all. Every Monday at 8:30 as we push the mantra, keep learning something new each and every day. Only on KUTV, a new experience.
All right. Welcome back to Biashara Tuesday. It's been 2 hours or so on this show, speaking about business and everything else that is in between. This show has specifically been touching on men's mental health, being the month where we are sensitizing men around their mental health situation. We spoke to Reverend A.D., who gave us a spiritual perspective on how you can use hope and patience to ensure that your mental health is in check. Earlier on, we're speaking to a fourth-year student of medical laboratory sciences, Isaac Ogutu, telling us about some of those other issues related to mental health, like high blood pressure and diabetes, this being non-communicable diseases. There are ways in which you can check for them early, prevent them, treat them, and manage them if you're diagnosed with some of those. Right about now, we're moving towards the current happenings in the Republic, because what is Biashara if not politics, which has metamorphosized into the economy? The Daily Nation on the front of the headlines, moment of truth. Today will be a fresh showdown which is looming to happen in the National Assembly and might be trickling over into midnight, or actually to tomorrow if the voting takes a bit of time. Between President William Ruto and Opposition Chief Raila Odinga's camp, there is a lot of talk going on back and forth on this controversial finance bill of 2023. It's now going to its third reading for the past 1 week. The past few days, since last week on Thursday, it's been in the committee stage, where the committee has to look at some of the amendments that they can include before the third reading, where now This will be looked at clause by clause, every item singled out, and votes discussed, and of course votes made later on. I see here on the front of the page 176 is the number of Kenya Kwanza MPs who voted to pass the finance bill during the... There's also Wetangula, who is of course Speaker over in the lower house, and Kingi in the house above him. The minority leadership in parliament has termed the two speakers unpopular for the decisions they have made, which they say outrightly favor the Kenya Kwanza administration and argue that the duo cannot be compared to their predecessors. On top of the Daily Nation edible oil scandal, the big story that's happening around the media and online and digital, as well as traditional media. Media players are calling out Kuria CS for attack on the Nation Media Group using words, slurs, which I can't even get myself to say here on this show. Cooking oil, baby food, whiskey locked up in supermarkets as shoplifting is now surging in this tough economy. At the bottom of the Daily Nation, you get that NHIF heist. Health CS is sending officials home amid a probe in branch managers who have now been involved in a cartel where rogue hospitals are stealing millions of shillings through medical camps which are targeting the elderly. And a lot of other politics also happening just alongside there. Matatus, which are Matatu drivers taking refresher tests. Ruto and Gachagwa's plot to fix Wamushomba. We'll be getting that bit from our conversationalist today, Kimani Wachira, President Emeritus. That's what you go by now, President Emeritus of the TVET Students Association. Welcome back to the show.
Thank you very much. We are grateful to be here to discuss and deliberate the state of our affairs of our nation, and more so dwelling into the gazettes and seeing what the editors have to say. And this is a reflection of our nation, a moment for the truth for our nation, as the headline reads, talking about the finance bill, where the Kenyans are going to know which way we are headed. Are we headed to the taxation way, or are we headed where the Kenyans are listened to by the people who they sent to represent them? It is a moment for the truth, not only for our MPs or legislature. It is a moment of the truth for our executive and judiciary. There is a case that was taken by Okia Umtata, and we are also waiting so much. Its decision is going to be influenced by the voting that is going to happen today. It's a moment of the truth for the executive, because as we have seen in various conversations, the president is eagerly waiting for this bill to pass. And by extension, saying that mpende msipende, which shows that our parliament is becoming an extension of the executive.
Right.
And also it's a moment of the truth for the Wanjiko, or now popularly referred to as Wagio, who is going to be subjected to this taxation that is going to be passed if each individual clauses is passed without amendment.
Right. I have a question for you, Kimani, so that we can kick off this conversation. The nation is calling it moment of truth. Is this moment of truth coming in too early into the Kenya Kwanza administration, or is it coming early enough so that the normal mwananchi can be now aware of the kind of administration that is running this government?
It is not too early, neither too late.
Right.
Because Wanjiko, when he made the decision on August, he knew what he wanted. We brought two candidates. Some of us were in Azimio and the others were in Kenya Kwanza. And Wanjiko, having analyzed all the manifestos and the agenda, decided to settle with the Kenya Kwisha government, or popularly known as Kenya Kwanza. And now, after all the deceit and the darkness was over, light came, and we are seeing what is happening. And this is coming too late. We have been expecting this government, which has no agenda for the people, but a few, such as those who are benefiting from NHIF and edible oil scandals, came to light. So it's a moment of the truth that has been agitated or brought about by various facts.
Looking at conversations that are happening in the media, where they have been having panels that are including people from the Kenya Kwanza government and also guys from the opposition side of Azimio, there's been a positive outlook when you see when you listen to the members of the legislature from the side of Kenya Kwanza saying that the president has already explained to them how this is going to be a very good way to raise revenue for the republic. It's a 3.6 trillion budget. There's a 700 billion deficit that needs to be patched up either through revenues or borrowing. The government is planning to borrow more and also raise 200 or so billion from middle income earners. And the people who are going to suffer the most in these new taxes and levies are middle-income businesses, medium enterprises earning around 500,000 and upwards of $1 million, and people earning 800,000 and above getting a 35% on pay. But there is a feeling that guys at the bottom are not going to suffer. That this is just taxing the rich to give back to the poor. The Robin Hood effect, as now is commonly known. Could you? If the president, says that this is exactly the type of economic model that I promised, a bottom-up approach, how could we fault him? How could we fault him on that?
We are not faulting the bottom-up agenda. We are faulting the way of implementation. One, as a nation, we are not going to develop if we have perennial unemployment problems that are always addressed within the first 2 years or 3 years to elections, and then we go back to the same cycle. Going by one of the suggestions and quoting the president on Saturday, he said that they are building houses not because we have a housing problem, but to create an employment. But the question is, after you have created employment for when building these houses, after 4 years when these houses are done, we have another looming problem of unemployment. All those people who were employed as KYM, as they are called, that is those who Kanda ya Moko is the name they go at, who are at the bottom of the economy. Those people who go to work daily and are paid on weekly basis. After 4 years, there will be no more houses to construct. They will go back to being unemployed. In our thinking, it would have been wiser if the government would have invested more on industrialization, where we create and we solve unemployment forever. Because if we create industries, if you tax Kenyans and channel these resources to constructions of industries, you have solved unemployment for quite a longer time. And you will create employment that is direct employment and indirect employment, where people, if you create each county, you make it an industrial hub. You create employment. There are people who are going to be directly employed by these companies. There are those who are going to bring raw materials to the companies. There are those who are going to be selling to these people produce, ranches that the mama mboga is going to cook outside there. That is solving the unemployment trajectory, or using I would say it is solving solving unemployment. But now if you do one industry, you don't expect somebody who did bachelors of business in commerce or entrepreneurship or any other business related course to find employment in NJE or the construction industry. And that's why we are seeing some challenges about people shoplifting mafuta, unga, because Wanjiku is hungry, as covered in our daily nations.
Right, and that's on page 27, where cooking oil is now being locked up. We're going to supermarkets, we are used to seeing TVs locked up, maybe phones behind a screen somewhere, but now we're seeing cooking oil, baby food. Mothers are now resolving to shoplifting for their babies. Whiskey, Kamnyeso Pale locked up as shoplifting is now surging in this tough economy. And we'll be having a look at that, which is on page 27. That's another moment of truth. I think the Daily Nation has covered it well today. If we are to speak about moments of truth, especially as it's been spread here on the front of the dailies, a moment of truth for the CS, that is Moses Kuria, moment of truth for the economy with the shoplifting, moment of truth happening over at Parliament buildings. And maybe to pick it up from there, as of the events of last week, you saw there was a walkout during CS Ndungu's CS Professor Ndungu's reading of the budget the next financial year. There was a walkout by Azimio MPs. Earlier on during the voting, during that second hearing of the finance bill, we noticed there was an absence of some members from both sides, that's the Kenya Kwanza side and also the Azimio side. Azimio was missing I think the minority of the members.
I will say it was not a missing. Wetangula was very deceitful.
How so?
Quoting what is written, he said that we are going to have a deliberation about this finance bill, and we are going to vote on next week on Tuesday, which is today. So members who contributed, such as Otende Omoro and the rest, after contribution, they left, thinking that the voting is going to happen today. But after they left, as quoted on page 6 of the Nation, after they left, Wetangula changed his mind and said that we are going to vote today. So it is a well-calculated move by the government to ensure that we disfranchise the opposition or the Azimio coalition, such that when they left, even some members of the ruling coalition did not know that it's going to happen. That is what is going to happen. They left after contributing, and then Wetangula said that we are going to vote today, and that is also dictatorial, because one minute you are saying this, and the other minute you are saying this, and we know where you have borrowed that script from. I don't want to say that we were told that we are going to get gases for the 300, and then 2 months later it is mitungi. I'm not going to say that we are promised that when our mothers deliver, they are going to be given flippers. And immediately 9 months after that, we have not had that conversation. We know where he's getting this script from.
Okay.
Yes.
Right. This arm twisting of the executive towards the government, I have to note that this is not something that Mr. Wetangula is new to. Before, while he was still a member of these houses, he criticized Justin Muturi for attending presidential functions. He also did speak out greatly against Chief Justice David Maraga and accused him of endearing himself to the executive. How is it that now hands have changed, the government is new, the government is fresh, but he's still doing the same thing as before?
They say that the forests remains, the trees remain the same. The monkeys are the same. Only a few things changed. We don't have a new government. You see, we previously had a Uhuru Ruto government. Now we have a Ruto Gachagua government. But all these people were part of the Uhuru government. We don't have new faces. So they are just opposing or supporting because they are in the different sides. Tomorrow, they are going to change sides, and Wanjiku is the one who is left suffering. For instance, we have seen as the DORA, due to the unfavorable government policies, has hit 140 at CBK. That
record low.
A record high, actually.
A record high, yes.
Of 140. And when they are selling it at 140 in Nairobi, you don't expect to do that the same exchange in our Busia Bonda, our Sirare Bonda, or Namanga. It is going at 150 something a dollar.
And this is going to promote a black market as well.
Yes. And we expect that we are going to bring investors to our nation. And whereas we have a government that is saying X and implementing Y, we had that the president said that in the next few months, the dollar is going to be at 120 to 100 when he was speaking at NSC, when he was opening Hasras buying shares at NSC. But unfortunately, instead of the trajectory going down, it is going upwards. Despite them signing an agreement with fuel industries in Saudi to buy fuel on loan.
In shillings.
What we are buying today, what the fuel we are consuming today has been bought on loan. We have not started paying for it. And the dollar is already at 140. I'm wondering.
There are new taxes as well, 16% VAT on fuel. That's coming up in July if this actually passes to law.
And we are waiting for the moment of truth today because we as Wanjiku, who elected our MPs, are we going to waiting to see their contribution today.
Right. To close it up, to close this part of what we're expecting in the National Assembly today, and following up on the headline, moment of truth. And I have to ask you, Kimani, then, is it really a moment of truth if we are talking about this being the same forest with the same monkeys from before? Is that really a moment of truth to wait for? The Daily Nation here on page 7 says, crunch battle for Ruto and Raila in finance bill vote. At the front of the Daily, they're calling it a fresh showdown. Is it really a moment of truth? Is there a showdown, or this is something we have already seen this before? Let's move on with it.
I think when they are talking about the moment of the truth, it is a moment of the truth in terms of rightness. Today, we are going to see which side stands with Wanjiku and which side support the oppressive regime. So when we are talking about the moment of the truth, it's a moment of the right for Wanjiku, who is going to be educated, who is going to be opened. The eyes are going to open and see what is happening. I understand that we have walked this path. We have been to do this path. We have seen its consequences. We saw that 176 MPs supported these oppressive tax proposals, and we are saying this. This is not the first, neither the last finance bill to have ever been created. We are going to have finance bills till eternity or till Jesus comes back. But this is going to be the most remembered finance bill in the history of the nation because it is oppressive. It is retrogressive. We cannot purport to tax Kenyans without addressing the moment of the truth of the nation, which is corruption. Corruption in edible oil, corruption in NHIF, corruption in each and every sector in our nation. We were told that we are losing 2 billion a day in the previous regime. And the previous government had tried so much sealing these loopholes for corruption. But today, I'm sure the figure has doubled, if not tripled. So it's a moment of the truth for each and every sector of our nation.
Right, talking about scandals, page 12 and 13, the big story that is now focused around media freedom, and also the role of the press in the republic. Now, this Kenya Kwanza government, even before it took power, we saw very scathing attacks and remarks from the President William Ruto, his deputy, Rigathi Gachagua, towards media. There's a time, media wasn't even allowed within the presence of the president during the campaigns back then. There was a time they were actually chased away, singled out, specific reporters and media houses actually pointed out, and, they really did not like how the media was portraying the campaign that was being run by the Kenya Kwanza government. Now we are seeing there's a scandal, the first of its like by the Kenya Kwanza government in the highest ranks, at least, which is this that is also involving CS Kuria. It's there in page 12 and page 13 of the Daily Nation, and it involves edible oil. It comes at a very funny period where when cooking oil we're also seeing is being locked up in this supermarket shelves as we are waiting to see this edible oil that CS Kuria is promising. There are remarks that have been made online and offline. Deputy President Rigathi Gachagua says he doesn't agree with some of the remarks that Moses Kuria made, but he's made remarks up until when he slept last night. I'm not sure that's the time he slept, but his last tweet yesterday night was pointing out towards, now we call them Biashara. That's a different variation. A different variation of the earlier very, very intense slur that I cannot use on morning television. This profiling of the media that CS Kuria is doing here has already gotten to the Media Council of Kenya, and there are statements here. I'm just going to read the first paragraph from the Media Council of Kenya, and also the journalist, the Union of Journalists in Kenya, the Kenya Union of Journalists. The Media Council of Kenya has this to say. The attention of the council has been drawn to the shocking and unfortunate remarks made by Investment, Trade and Industry CS Moses Kuria against NMG, that is National Media Group, and its staff. The council that notes that this is the most extreme since independence, that individuals have pushed media and government relations to the brink and lowered the country's dignity. The professional conduct of media and its workers is governed by the Code of Conduct for the Practice of Journalism, while the Media Complaints Commission is mandated to handle grievances against the media. So basically, just pointing out the right channels in which CS Kuria can use if he has any problems with journalists in the Republic. The Kenya Union of Journalists, through its SecGen, that is Eric Oduor, says, we will wish to remind Mr. Kuria that he is now a cabinet secretary whose actions and utterances should promote a positive image of Kenya as a nation, in line with tenets of leadership, integrity, and the law. While we support the ongoing initiatives by DP Rigathi Gachagua to deal with the impact of this rampant consumption of alcohol in the country, it is our opinion that for this war to bear fruit, it should cast the net wider and get rid of the county of leaders who are not in control of their faculties. He should cast his net wider to rid the country of leaders who are not in control of their faculties. In short, as we are battling drug abuse in the Republic, the Kenya Union of Journalists is saying that DP Rigathi Gachagua should start within the cabinet. It seems that there are few people within the cabinet who might be intoxicated with power or otherwise. There's a cartoon there from the Daily Nation by Gado as well, by Dula, and also this other one on the Standard. Maybe we can have it as I get your reactions, Kimani, as according to what is happening. There we have it. There we have it on the screen. Pale kuna miti, Ministry of Investment, Trade and Industry.
Yes.
That should be Moses Kuria inside. There's edible oil that's leaking. The media is shining a light, and they say, or Kimani Washira said here, where did you say it? You said it online, on Twitter,
Yes.
that the newspaper kills two things, yeah? A fly
and that is Tarinduku Elders says that a newspaper is used to kill both the flies and a politician.
Right.
And if Moses Kuri is not quite serious and can't some of his statements, he's repeating the same mistakes that Uhuru did sometimes back when he said that hii gazeti ni ya kufunga nyama, and we have seen what happens. The ripple effect was negative publicity, which overturned his public ratings, and we saw even his candidate not winning because of the impacts of some of these statements.
Right.
Moses Kuria is out of order. Moses Kuria is the Minister of Trade. And we have seen what other ministers have done when scandals have been mentioned. We saw the president sack Kemsa. Kemsa was reported by our media. Scandals. On Saturday, there was the reportation of the oil scandals. The minister on Sunday, in a church event, on the altars or tabernacle, made declarations that are ungodly, they are immoral, illegal, unconstitutional, and uncool. Attacking an independent body that should oversight the government. We have seen these attacks, and they say that the strength of a tree, no matter the size, depends on the roots. And the Kenya Kwanza government interaction with the media, the roots have already decayed. And it is very immoral to hear the language a minister who is the face of trade in Kenya is using. Right. I'm wondering, is this the conversation he has in USA or
when he's speaking to investors? Gado has a very interesting image this morning. You've mentioned about face and whatnot, and they are portraying where the words are coming out. These slurs. Apparently, they're not coming out of a face. As you can see there on your screen, there is a goat there. It seems that media has actually found, they've actually been able to find something to portray Moses Kuria, the goats in Gatundu, which have now disowned Moses Kuria, and I've asked Gado to kindly check with the dogs, yeah? There is a tweet here, actually even this morning, maybe you can picture it as that image shows there. And imagine Moses Kuria saying these words, because this is his tweet from 8 a.m. today. Good morning, Kenyans. Have a splendid day from a brothel on Kimathi Street. That is a CS, someone who sits on the highest ranks of office of this Kenya Kwanza government.
If this was a tweet from a minister in USA, he will have resigned. Even if it was done by his PA, he would have resigned. We are saying that Moses Kuria is showing how we Africans don't take things seriously. How we have leaders who are morally decayed brains. Because you don't expect such a high profile person in this regime to make such altercation. I don't expect even my mzee wa nyumba kumi man to say such things in the limelight, in the public. this talks about our community. So we say that viongozi ni vioo vya jamii, that our elders, our leaders are
a reflection
of our community. It is so absurd, and I'm lacking words to say.
Right.
And I'm telling Moses Kuria, run from the CS health. When scandals are mentioned, just do due diligence.
Right, and that's what I wanted to say here, that, as much as he's doing these laws and public showdowns and all of this social media shenanigans, let's not forget the oil scandal. Let's keep tabs on how this edible scandal plays out. Whatever he says, we have to ensure that we're keeping him into account. It's 9:55 in the morning. Kimani Washira, we can't do much more than we have. Unfortunately, we have to wrap it up at this point. If you have the dailies today, please check out the headlines and the stories that are making business for your week. Biashara Tuesday sets a tone for you, and we have tried as much as possible to do that with the conversations we've had and with what has been there on the Business Daily, the Daily Nation, and the Standard. Let's close it up with the last word, Kimani, at the back of the Business Daily, and please tell us who that is from.
We are going to quote an Australian British philosopher called Karl Popper, who said that we may become the makers of our fate when we have ceased to pose as its prophet.